Hello everyone, my name is Jamie Ellen Stapp and I'm covering Godfrey Oakley and the fight to prevent spina bifida and folic acid. With folic acid. Step 1 is background. So spina bifida is actually a birth defect involving incomplete development in the neural tubes in a fetus. So most commonly it affects neural tube development and more than 4 million babies are born with this each year in the United States, and it affects almost 160,000 individuals. Now, few people can get surgery for this, but about 10 to 20% don't need to because they have spina bifida occulta, which is about like a medium form of this. Now, currently there is no cure, but it can be prevented with folic acid in the prenatal stages. Now, step 2, current situation. The problem is that most women don't really know much about folic acid when they are pregnant, so they're not able to make enough DNA that can actually nourish the baby's brain and spinal cord to develop normally. Now, the strength is that women who consume 4,000 micrograms of folic acid before and during their pregnancy have a 72% lower rate of spina bifida and anencephaly for their child. And anencephaly is basically babies who are born without a brain. Now, weakness is that there's no cure for spina bifida, and the opportunity is that folic acid can make spina bifida more preventable, as the vitamins of this act as an ally, and it opens up way more opportunities for research, and resources are also available for this as well. Now, the threat is that this does have long-lasting disabilities. Step 3, we are prioritizing our core issues. So most people are actually uneducated about the many benefits of folic acid and also spina bifida as well, and they don't take them regularly throughout their pregnancy or just in general, as there are many health benefits. Now, the cause of spina bifida is currently unknown, and results of the zippering at the bottom end of the neural tube where the spinal cord meets the brain. And it is incomplete. As you will maybe recall from the first slide, there was a bulge on the baby's lower back, and that's where the bottom end of the neural tube meets. It's bulging. Now, it does result in some degree of paralysis, as you'll see in the image to the right, and problems with bladder and bowel control. Now, in the summer of 1991, there was a study and actually proved folic acid can prevent spina bifida and encephalopathy, as well as miscarriages. Now, it actually is one of the birth defects that takes up about 6.2% of the United States population. Now, step 4, we're analyzing alternatives. So, Children's Hospital in Philadelphia did a research that actually showed that you can actually do surgical repairs in the early gestational stages of pregnancy, and this allows the fetus to actually do rearrangements because there's a lot of like plasticity involved in this, and it can actually redevelop their nervous system. So when you do a lot of the, I guess, like repairs and stuff like that, they can actually redevelop their nervous system. And they did that on a mom in her early gestational stages. Another case was in the Journal of Pediatric Psychology, and they actually did physical therapy treatments on an 8.5-year-old boy, and this improved his motor function. And in the trans-theoretical model of the health belief model, they actually gave low-income women more folic acid because they didn't have a lot of access to it, and this actually reduced a lot of their areas' spina bifida cases, as they showed that they just didn't have access to these. Now, one alternate solution is to consider having individuals with the more severe cases partake in surgery, as this can relieve ischial pressure, repair lesions on spinal cord, repair deformities, curvatures, and concave rib resections. Another thing is to consider physiotherapy. Now, this is actually a technique used when on small children. You can actually use encouragement and positive reinforcement from parents and therapists to have them go through life and actually get them to walk and such like that. Now, the picture on the right is actually of doctors, I guess, modeling going through surgery. Now, my recommendations is actually to use folic acid, as it is a preventative method, and it's actually recommended most by CDC and the Public Health Service. And as you can see in the picture, about 600 to 700 babies are actually prevented each year of spina bifida cases, and we save so much money from medical bills as well. And I actually recommend that a lot of physicians offer the ability for more women to have testing done for spina bifida cases and anencephaly. This way we also incorporate the opportunity for folic acid into the vitamin routine, if not already. My action plan is actually to have a way by 2020 to have the healthcare system educate more women about the benefits, and I believe that one way to do this is to offer the screening, but as well, uh, if by any chance by 2025 we can have pamphlets about the folic acid benefits in healthcare offices. I think that'd be amazing. And in my own opinion, I believe that folic acid greatly decreases birth defects as well as miscarriages, and that we can continue enriching food with it. I also think that the education in this is really important, and we can start by including pamphlets in the offices. My comparison is right here of Europe, and here are my references. Thank you.